So I just had a daughter that was born 2 weeks ago. She's
She
amazing.
tongue-tied?
Well, her tongue looks okay, but I
Mhm.
believe that she might have an upper lip tie. See
Is
what you
she
see?
feeding okay?
Well, she was initially, but now her upper lip is starting to peel off the latch.
Oh,
Can you s
yeah, she is a little tethered. It's down low, isn't it?
Yeah, it is. It's all the way down to the base of her maxilla.
So here's the problem. It really depends on the philosophy of who you go see, whether they're going to release it for you. I would probably do it if you're having trouble feeding, just because what's the risk, right? If the baby's exhausted and mom's exhausted and it's way too much work, then it's worth a shot because there's almost no downside to
Right,
fixing it. But a lot of people say, well, no, it doesn't do anything. It's not necessary. It's not needed. But how do we know?
right.
Really, there's not a lot of data. There's good data on tongue ties and breastfeeding for sure.
Here it is again.
Oh, yeah, that's
See
a pretty
that?
good one.
That's a pretty good lip tie, right? Look, it's even
Mhm.
taking where her front teeth are gonna be, and it's kind of
Causing a little notching, yeah,
it's notching the maxilla area.
yeah. I would. I mean, if you
You
could
would,
find
yeah.
someone willing to do it for you, it's probably gonna it very least, it'll do nothing, but it has a chance of helping,
Yeah.
making it easier. So, I mean, she'll cry for a second, but then they kind of forget. It's like it didn't happen.
How will they do it? Will they just take a scalpel and just cut up?
Usually, it's a little scissor.
2 seconds, boom,
Mhm.
in and out. Will they anesthetize?
No, usually we don't because the risk of anesthesia is worse because babies can have allergic reactions even to that. So sometimes you'll put a little pressure to keep her from feeling it and then just real quick and then
Yeah.
feed right away so she forgets about it.
Yeah, yeah, yeah. I've gotta find someone locally that can do that for her. All right, back at Dr. Kuljic's office. I'm here with my wife, Alexis, and our baby, Margaret. We're here actually to do Margaret's lip tie release. She has a pretty severe lip tie. If you want to get a closer look at that, maybe I'll put an image of it in the video right now. I also discussed it with Tieu, the ENT, but Dr. Kuljic is a friend of mine and a local airway-focused dentist, and I met him at Dr. Lipkin's MSE course, and he is going to help us out with Margaret's lip tie. Babe, how are you feeling about Margot's lip tie release?
I'm gonna cry.
I know, me too. But it's for the better. It's a pretty severe lip tie. We do notice it in her latch. We feel like she's
Swallowing air.
taking in a lot of air, which what effect does that have when the baby takes in a lot of air when she's breastfeeding?
She gets gassy.
Right, because you can imagine when you're swallowing air, that air is going to pass through your whole system and come out on the other end. And that's how you get a gassy baby. So we're hoping the lip tie release improves the latch, reduces the gassiness, and just makes for a happier, healthier baby. All right, let's go into Dr. Kuljic's office. Oh, damn. It's right on the board here. So myofunctional therapy seems to be a big part of Dr. Kuljic's practice. The 4 goals of myofunctional therapy: lip seal, correct swallow pattern, tongue resting position, nasal breathing. You know, in my ebook, that's basically what I call mewing. And that's why I say that mewing and myofunctional therapy are really the same thing with a different name. And myofunctional therapy is essentially having a mewing personal trainer. So for all you mewing fanatics, you probably hear the word myofunctional therapy, you have no idea what that means, but really it's the official medical term for mewing put into the form of a kind of controlled physical therapy in the hands of a professional.
I'll see what I have to do a little bit.
Honey, I'm gonna peel her lip back so we can see that lip tie. Oh, she doesn't want. I can't do it. I can't bring myself to do it.
Yeah, she's not in the right head position.
Oh, I love her so much. All right, baby Margot just had her lip tie release, and it was a piece of cake. I mean, Dr. Kuljic went in there, hit it. It took him like literally 2 seconds, with the laser, and she cried for another 2 seconds, and then immediately she went right onto the breast. The latch, we noticed, was immediately better, especially the upper lip was getting a nice sort of wrap around the breast, and we're happy.
Very
Could you notice a difference right away with the latch?
Yeah, and I looked at the frenum.
Yeah,
And it's a perfect little slit right across. So we have to do some myofunctional therapy exercises. We're gonna have to kind of massage the area and pull out the lip in about another day. And if it bleeds, they said that's normal, but you just gotta make sure you do those exercises so that she doesn't create scar tissue, and then you'd have to get it done again.
Just like a tongue tie release in an adult, you have to make sure you stretch it after the release, otherwise it could heal shorter, even worse than it was before. So with the baby, we're just gonna do some lip peels for a couple days or longer. But I would say breastfeeding should help with the elongation of that area and get it to heal nice.
Yeah, and if your baby is going in for a lip tie release, do it around their nap time. Make sure they have a full belly so that they're really tired when you go in, and then just put them right on the boob after.
All right, we're happy. Thank you to Dr. Kuljic and his team. Great work. Peace. All right, hon, so we're 3 months since Margot did her lip tie release with Dr. Kuljic, and right now I just want to get your opinion on the overall results from that and what you think the impact was.
Margot's lip tie started off looking like this, where the tissue went all the way to her upper lip. You can see right here.
Yeah, toward the tip of her lip. So that's before the lip tie release.
Yep, that was after. As you can see now in the beginning, it went all the way down to the bottom of her maxilla and all the way to the tip of her lip. And now it stops right here and there's no pulling.
In the after image, it still looks like there's a lot of frenum left and that it's still tied. But when you compare it to the before image, you can see that before it was actually much worse. And Dr. Kuljic specifically said that he didn't want to overdo it, right?
Right, he said that you can always start small. He used a little laser and he just zapped it, I think maybe 2.5 times, I would say. He always says you can always come back. And there's definitely a significant amount of tissue left still, but at least now her lip is not growing up, okay? It's not being like pulled, and her jaws are able to come forward now that there's nothing stopping them from moving.
And can you speak to the difference in breastfeeding and her latch after the lip tie release?
Her latch is good. She's always had a good latch, but I'm sure that it is better because she's gained a lot of weight since then, which is a good thing. That's pretty much the only indicator that I can say that the lip tie release was successful, because I didn't think she had a gas issue before, although all babies are a little gassy, I think. She's much better now and she's really big, so I think she's taking in more milk now.
And what are your thoughts on her overall facial development, and what's that journey been like for you?
Well, I'm always having to close her mouth because babies, when they're sleeping, sometimes their mouths are open, and when they're hanging out like this, sometimes her mouth goes open, but you always have to close it. I think honestly her face looks symmetric and it's beautiful. I think it's because of breastfeeding, and I've noticed that her jaws are coming forward on the bottom. There's some pictures from when she was first born where she looks a little recessed. I don't think she's as recessed anymore.
Good. So happy you did the lip tie release overall?
Yeah. Because if we never did it, you know, maybe an issue could arise where we would have wished we would have done it when she was a baby. Just, it's better to just do it if you see the tie. Just get it when they're really little.
And you're happy with Dr. Kuljic's approach of doing less rather than more, the conservative approach?
He was very gentle. The girls in the office were really supportive and really nice. And the baby practically slept through the whole thing. It was nothing. I was so worried, and it was over in 30 seconds.
And can you talk briefly about how much breastfeeding you're doing and what that's been like for you?
So breastfeeding, it can be challenging if you have something to do where you're away from home for an extended period of time, but I can pump in the car if I need to, but we do breastfeed every day, about 6 to 8 times a day now. When she was really little, we probably breastfed between 10 and 20 times a day. But yeah, we're supplementing with formula, but we're always going to be breastfeeding until she's probably at least 2 years old, and she's gaining really good weight. She looks like a breastfed baby. She's beautiful. She's healthy. She's getting those probiotics she needs through the breast milk. And yeah, she's just really healthy.
Talk about the time she got sick and what that was like, and has she been sick much? By the way, she's exactly 4 months old now.
Yep, she has been sick one time, and they suggest when a baby gets sick when they're an infant like that, like she was only, I think, maybe 10 weeks old when she was sick with COVID.
She did test positive for COVID. I did too at the time.
Yep, and they just said keep her comfortable and keep her on the boob. You know, if you call the hospital and you tell them your child has a fever, they'll ask you, do you know what it's from? And if you know what it's from, that's great, because then you know it's just something that will pass. It's not some acute issue that you need to bring them to the hospital for. So we just kept her home, kept her comfortable, always breastfeed whenever she was uncomfortable, and tried to break her fever if it was too high.
Yeah, overall, pretty healthy and happy baby, right?
Yeah, and she never gets a bottle without breast milk in it. I don't do full formula bottles. I do half breast milk. I seek out breast milk donors because I don't produce enough, and this is definitely a baby that prefers the breast milk. If I give her a bottle without the breast milk, she's not happy.
Talk about where you get that breast milk from.
There's a Facebook page. It's a private page, so I won't share it, but if you ever need to find breast milk in your area, just contact me on JawHacks Baby and I'll help you find them on Instagram.
But overall, you can find breast milk on Facebook.
There's so many breast milk pages on Facebook. You can even find it on Facebook Marketplace. Breast milk is usually sold probably between 50 to 75 cents an ounce, but I try and get it for free. People who donate breast milk know what you're looking for. They want to know if the baby has allergies. They'll tell you if they drink. They'll tell you if they are on medications. You know, you have to make sure you do your homework, but if you can find a good breast milk donor, stay with them.
Yeah. All right, sweetie. Margot, thanks for being part of the video, and we're glad that your lips are feeling good and that you're feeding well and that you're growing up to be healthy and strong. And we love you very much, sweetheart. Bye-bye.